So why then is it the case that some people have difficulty? If this is a tool that can empower and enhance, what might be the difficulties with doing that? Because I think all three of us know that some people and sometimes at some times people will have difficulty doing that monitoring. Grace, what would you say are the difficulties that people have expressed to you?
Yeah, so in my clinical practice, I hear it pretty much every day. I heard it today, where a patient saying to me, I don't want to test my glucose levels because I'm fearful that it's going to be high. That's one thing. And they don't record the highs. So we encourage them to bring the glucose meter with them to the clinic so that we can actually navigate through the system to understand what's happening in order to help us make our decisions. The other thing that a few patients said to me today was that it's painful. I don't like to prick my fingers because it's painful. I feel like a pin cushion. But sometimes that's due to the way and how they're pricking their fingers. They may be pricking the pads of their fingers instead of the sides of the fingers. So we look for ways of how we can solve some of these problems to make it easier and a bit more comfortable for the patient. And also the frequency, how often they do their blood glucose levels, in terms of the number of pricks per day, for example. Mainly people with type 2 diabetes would be doing the finger pricking test, although we know going forward that NICE has produced some guidelines which says if they're on multiple daily injections, they too can have the flash or CGM monitoring. So also, patients who have, in my experience, mental health conditions, where they don't engage, it's another way, a tool that we can, work with them to engage, to support them, to help them manage their diabetes day to day.
And Grace, before I move on to ask that of Gideon, I want you, if you don't mind, because so many people have such difficulty with this, to show us where you should be doing your finger pricks when you're doing your finger prick testing.
Okay, so we know that we don't use our thumbs and our index fingers, and we use the latter three. You want me to show you?
If you don't mind.
We use these three fingers, and we use the sides of the fingers. On both sides of the fingers, you can test, and it makes it easy to apply the blood onto the strip. And therefore, the test, to make the test a bit more significant rather than smearing. There's a capillary action where you put the blood sample close to the strip and it sucks it up and it goes in, and the meter then reads the blood glucose level.
Because I think, thanks, Grace, because I think the tendency is most people will go for, in the pulp, and that's the painful area, and that's what we want people to avoid. So it just happens so frequently. I thought, we can literally say this is where. So Gideon.
In terms of what Grace has just said, I just echo what she has just said. And the difficulties with different patients I've come across or met them, why they're having difficulties monitoring, there are a lot of factors. There's something called social determinant of health. One of the factors is about the socio-economic status of some of our patients. Some patients, they are saying that I'm doing night shifts, I'm working 2 jobs, I don't have time to sit and check my sugar levels. So in terms of approaching these patients or supporting them, it's about a holistic approach. It's about motivational interviewing that, okay, how are you? How is your family? Because once somebody is diabetic, it's the whole family need to support her or him. And what about the workplace? Are we supporting these individuals? That can we give them the time they require? That because you are diabetic, can you do 9 to 5? Don't do shift pattern. So there are a lot of factors. One of them is the socio-economic status of these patients who are very special and what they do in their lives. So if you say that you have to go and exercise, maybe once a day go and walk, what about a taxi driver whose job is to drive a taxi or Uber driver? They are sitting for 10, 15 hours. They will not have time to go and exercise. Is another factor that if I'm driving, I'm not able to exercise, maybe I'm not able to check my sugar level because I'm very busy. My colleague Grace has just mentioned that we tend to, most of the chronic conditions, including diabetes, there's an element of mental health in them. Any chronic condition is associated with mental health. Us as healthcare professionals, sometimes we don't see behind the person, because when the patient comes to the clinic and says that, give me your readings, what are the readings, why are you not checking? But we haven't asked them, how are you and what's happening with you? If they've got element of mental health issue, they need support in that. That's why I know that some of the centers, they use a multidisciplinary clinic, including psychologists, psychiatrists, endocrinologists, or diabetes team, diabetes nurses supporting these patients. And we will do that better with a lot of support. I would say that the factors for this are multifactorial. It's not only one factor.
Yeah. So I'm going to ask both of you then. We talked about how to make the finger pricking less painful. What other tips would you give for somebody who might be having some difficulty monitoring their blood glucose? I mean, one of the things that I sometimes do is I say, that, okay, there's too much going on in your life. I understand that this is going to be difficult for you. Perhaps if you can, maybe once a day, once a week, some reasonable frequency of testing. And sometimes actually the person just has to not test for a while, but then we can say, let's pick it up again in a month, in 2 weeks, in a period of time when less is happening in your life, and then you'll be able to concentrate on it more.
Yeah, I think it's important to be non-judgmental. And I think it's important to be mindful as healthcare professionals of the language that we use. And we know that we have this really great document called Language Matters. And I've heard many patients feel bad or said they feel bad because they might have had a very high blood glucose levels. And we tend, as healthcare professionals, we tend to focus on that. And they feel that we're likening them to that actual number. And we're kind of trying to, although we don't intentionally do this, we try to focus on that, and that makes them feel inadequate in some ways. So it's about how we engage with them, the language we use, and also how we make them feel supported and being very trusting, and also, to encourage that that professional relationship, which makes the patient feel that they can disclose what they need to disclose to us without being made to feel judgmental or judged.
Gideon, any tips that you've got?
So I think what you've tried to describe initially, that we have to try, and it's called motivational interviewing, trying to make sure that whatever little they're doing, we have to give a positive reinforcement. I think what I tend to approach in terms of secondary care, I've got few patients who are having difficulties monitoring, and sometimes what I tend to do is to stagger. You just do one day of the week, maybe Monday, you do before breakfast and 2 hours after breakfast. The rest of the day you don't do. Then I would say maybe Tuesday before lunch and the 2 hours after lunch. Then another day before dinner and 2 hours after dinner. So the morning readings, if we say that the routine is the same, we represent all the morning readings. And with that, you can try and support them by getting some evidence that they're checking in the morning, but it's not as often, but that's how they should be doing. And I think that's one way of doing it. And sometimes if I try and talk to them, we look at what will happen. I'll give you an example of a patient I've seen, and I've ended up giving them the maybe advanced technology in terms of giving them flash glucose monitoring. So I run antenatal clinics. Sometimes in antenatal clinic, we get patients who have maybe gestational diabetes, but if we are getting a bad control for a week or two, we are not sure, because these are patients who are pregnant, they are worried, they are busy. Sometimes we give them the flash glucose monitoring to just get a picture of what is happening for a week or two, one sensor for 2 weeks. I've had patients who are diabetic, type 2 diabetes, on dialysis. I'm talking about hemodialysis. And these patients, they've got fistulas in one arm. So they can actually use finger pricking where the fistulas are. These patients qualify for fast glucose monitoring. I give it to them for that reason, to try and support them. I'll give you an example. I support the cancer day unit within the hospital. It's an oncology unit. We get patients who are having chemotherapy on steroids. And the short term, when you give them steroids, they get hyperglycemia. These are patients who are very special. They've got cancer. Why not provide them with flash glucose monitoring? And that's why I'm trying to make a case, because these are patients that they are worried about their disease. Self-monitoring, yes, it's possible, but it's painful. Why add more agony to somebody who is already stressed because of the disease they've got? So there are a lot of ways of trying to support them. And if there's a necessity to give them technology, I do so.
Thank you very much. Thank you both. Sorry,
Joan,
Grace, you wanted to add
I was
something?
just going to add something that was drummed into me as a up and coming diabetes specialist nurse by my professor. And what she always used to say to me is to focus on the fasting blood glucose first. So setting that goal with the patient that we're going to just look at the fasting blood glucose first and work towards getting that blood glucose level down to 4 to 7 if that's appropriate for that patient, maybe 4 to 6 if it's a woman who's pregnant, or if it's an elderly patient, we might go for something like between 7 and 8. So setting those goals that we can focus on, and once you achieve that one goal, we can then move on to the blood glucose levels the rest of the day. And that's how I find patients are more engaging. They just have to focus on one thing, and we work together to get that right. By the time we get that right, they're ready to, and they have the tools to actually manage the rest of the day.